Go ahead.
Hi everyone, it's Julie, and I'm here with Marc.
Hi, everybody.
Marc's my life partner, and we actually share an office here in Boca Raton, Florida. And anyway, just I'll leave it to you, Marc.
So I was doing a video this morning for my business, South Florida Intervention, and one of the things I was talking about is kind of what I'm seeing in the climate of business, some changes that I've made or are making in my practice in order to reach more people, to be more available. And I think that we are in unprecedented times. Nothing has ever been like this. You know, I think about businesses and I say, you know, if you were sitting around and doing your business plan and you said, what scenario could there be where we have to close all our stores nationally, or, you know, more than a couple, like a war, like what would it be? And this is it. This is COVID-19. So a lot has changed. What are you seeing in terms of your corporate clients? What are they looking for? What's going on?
No, that's a great question. I think that we have, first was the COVID pandemic. And the first realization is that people were going to be working from home. Mm-hmm. They weren't going to have the water cooler conversations anymore. They were going to be working from home with new colleagues, their kids, their spouses, we were home for a couple of months. Now we're actually in the office.
And we don't have little kids.
No, you can see her behind us. She's now 17. But I think that, so the first thing was that people didn't want their employees to be isolated. Mm-hmm. And they needed to find a way to help people connect. So everyone went on Zoom. Mm-hmm. But the problem with Zoom is people started tuning out.
Right.
People started getting distracted. They started doing their laundry. They started, taking off video and writing grocery lists, or walking around
Facebook, LinkedIn. They checked out.
They started checking out, and a lot of people were feeling even more lonely. They were feeling isolated. They were feeling lonely. So what we did was, we are pretty known for flash mentoring, which you've experienced firsthand. We did it in Dubai.
Yes, we did.
At a global women in STEM conference, and you joined me. That was a really fun trip.
That was fun.
So we did, we took the entire audience, everyone. We had about 500 people in the room, and we created the space for people to have one-on-one conversations around the things that mattered, and kind of 6-7 minutes speed mentor each other. We brought all of that online. Mm-hmm. And so for the first couple months, every week we were doing a flash mentoring session. And then we started getting some contracts because companies wanted to bring it in-house. They're worried about their employees isolating. And this creation of the one-to-one experience, we saw a 97% engagement rate versus typical Zoom calls that were like 50% and 60%.
So when you were doing breakout sessions, you saw high engagement compared to when you had a Zoom call or a Zoom conference, where someone was just talking for 45 minutes. When people got to participate, it goes way up.
Yeah, because it's like us talking right now. We're one-on-one. We are paying attention, or else we're rude. We're not looking at our phones while we're talking. So it's the same thing in a Zoom room to create breakout session. And one of the questions that I love was asking people if they could fast forward to, what is today, July
13th.
I don't know what today is. July 13th.
I know today is July.
Today's July, yes.
So
yes.
I think the 13th.
Okay, we'll go with that. So July 13th, 2021, if you could go meet Marc Kantor on July 13th, 2021, what advice would he have for you? Yeah. That's 1 year from today. Yeah. About how you dealt with COVID and these unprecedented times. What is your future self telling to you now? Right. And thinking about it and sharing that with another person might help you formulate some strategy and actions that you hadn't thought about before. So we create a lot of scenarios like that. Then the protests came, and Black Lives Matter just boomed. And, this has been an incredible time for, I think a lot of companies are calling us now, more than ever, to talk about race and how to mentor and sponsor diversely.
Yeah.
A lot of times, like, you know, you think about, who do you mentor? Who do you sponsor? Is it your friends? Like, we were sponsoring one of our neighbor's daughters the other day.
Yeah, yeah.
To try to help her get a job.
Yeah.
Why? Because she asked.
Yeah.
And we remember her when she was like 6 years old. And
no, not even. I think she was like 2 and I remember her
cute.
as a toddler. Yeah.
We love her, Nandini.
Yeah,
We
yeah,
love her. So of
yeah.
course we're going to help her.
Yeah.
So you tend to champion your friends' kids, your employees' kids. You tend to champion your own children into opportunities. And then people you like at work, who you play golf with, or you go to the spa with, you spend more time with them, so you're willing to champion them in their career.
People stay in their individual silos. They don't.
Yeah.
They don't break out, and they're not.
Yeah.
Yeah.
And they tend to mentor and sponsor people who look just like them. So if you want more diversity, you need to sponsor and mentor more diversely. So now we're just helping companies launch diverse, inclusive mentoring programs. And we're having a lot of conversations about that. People who wouldn't talk to us. People like hang up the phone or just, yeah, Julie, yeah, let's talk in 6 months.
Yeah.
Now want to talk about driving diversity through mentorship and sponsor. And it's really diversity meets mentoring. And the then is inclusion and a greater sense of belonging, which also ties to what you do, Mark.
Yeah. Well, it's become a necessity. It's no longer something a good want to have, or we'll do that at some point. It's now. I mean, I think the culmination of everything that's going on in the world has made it a necessity right now. People have to address it right now, which is a good thing.
Yeah.
Yeah.
Yeah, and I think because if we're seeing a spike in mental illness for people. We're seeing a spike in suicides. Before COVID started, 54% of Americans felt they didn't have someone to talk with.
Yeah.
And, you know, I know we've been sending our parents Facebook portals so that we can have dinner with them. My mom has barely left her apartment since March. So we have dinner with her on Facebook portal. Which is amazing. I'll have to tell you more about some really cool technology.
Really well. Yeah.
It zooms, it follows you everywhere around, and you can be like cooking in the kitchen and moving all around. The camera zooms in and follows you. It's amazing.
Yeah.
But we have to find ways to better connect because it's not good for our mental health. And, you know, often people, as you can speak to, what happens when people try to push down all their emotions? What are they're self-medicating, and you could speak to that with what you do.
It comes out one way or another. But one thing I wanted to mention, based on what you were saying about it, you know, one of the first things I learned about addiction is that crises precipitates intervention. You know, you don't. You know, in my business, you don't go to treatment until you see the flashy blue lights, till you come home and your wife's taken the kids and gone. And I think that's...
Well, don't point at me when you say that.
Well, and I think that's what's happened now, is that, you know, there's been a crisis, and you need that crisis to precipitate intervention, to precipitate change. Yeah, but isolation, you know, in my line of work, in the mental health field of behavioral health, is the absolute worst thing you can do. It's, you know, mental illness is not fatal. It's the isolation that makes it fatal.
Yeah, and I think one thing that's really I've become increasingly aware of, and I know we haven't talked a lot about this, but, you know, we've been together 23 years. We have a daughter. We have a beautiful family. We have family around. I have awesome people that I work with my company of 5 years, Twomentor. And I still I can find myself isolated, depressed, siloed, and I have to remember... you know, we've had challenges that we've had to confront, and I realize how important it is to reach out to someone.
Yeah.
Because even with a world around you, you could be walking through New York City and it's packed.
And you feel alone.
And feel completely alone.
Yeah.
And I've learned just even the last few weeks, I need to reach out to people better. I need to check in on my girlfriends better. I have to... I have to ask for expert advice with my business. I've had business challenges, and talk to my CPA, talk to a lawyer, call an expert. I'm in Entrepreneurs Organization. I've got my mentor who you met the other day, and we
mentor
talk.
Mitch.
Yeah, we talk every 2 weeks now, and whatever I'm going through, he's gone through things like that. So, and then I'm not alone, and then I feel psychologically better. But even in my field of, human connection through mentoring, I still have to remind myself to go out and get mentored or go out and help others, because when I do either of those, I feel so much better. I break out of depressed feelings. I feel more plugged in and recharged. And of course, getting out and getting some fresh air and exercise, which you're much better at than I am. But that helps.
Well, the thing that I'm hearing a lot now is that people are saying, and professionals in my field are saying, is that the opposite of addiction is not abstinence. The opposite of addiction is connection. And I think that's really important. And even if you look at the mainstream curriculum for sobriety, which is the Alcoholics Anonymous curriculum that goes back to, it was published in 1935, the prescription in the book is a chapter called Into Action, not into thinking, not into contemplating, not into feeling sorry for yourself, but into action. And then the further prescription is working with other people, is helping other people, and sharing. If you look at the language of the 12 steps, it's we language. We admitted we're powerless. Shared with other people the exact nature of our. It's not in, it's out. It's more connection. And I think there's a correlation between that and what you guys are doing. And
well, I think corporate America could learn a lot from 12-step programs, because in a 12-step program, there's a lot of laughter. People have gone to 12-step to overcome whatever addictions they have, and so when you go into a 12-step meeting, one of the first questions is, do you have a sponsor? Which essentially is a mentor, in 12-step language. But people are open, and there's a lot of laughter, and they get that help, and they they have anonymity. And I think a lot of times in corporate America, there's a number of reasons people don't ask for help. Number one, they don't want to be perceived as weak.
Right.
Number two, they don't want to intrude on someone. Number three, they've got a lot going on in their lives. They're busy. And we have a saying that often when leaders climb the ladder, they forget the ladder's there.
Right.
They're off to Aspen. They're off to board meetings. They're off to with their kids and their families and their vacations and managing others. They forget to mentor.
It's easy to forget. But I think also what's interesting is, and you talk about being afraid to ask for help, being afraid to one of the reasons the 12 steps works is because it's a space where people can connect through vulnerability. And if you've seen the Brene Brown video, all her research, she's a researcher, is what she does, is about where people connect at a vulnerable level. That's why you hear stories about people when they're in the hospital, when they're recovering from cancer surgery, friends visit them, and they share everything with them because they're vulnerable. And I think that vulnerability in the workplace is not there, and it's perceived as a weakness, as you said. And there are people in the workplace. Look, I came from commercial real estate, which is a very aggressive, manly, personality, type A.
Yeah, those office.
A business, and
you guys would go. Sorry, I just have to throw in. I remember one of your friends was in the restroom, and the guys would come and shut the lights off on him when he was in the bathroom, and
it's very fraternal.
Very fraternal.
Yeah, and there's not a lot of room for vulnerability. So that's that. And that's what I love so much about my business now, being in the behavioral health space, is that I can get together on a professional level with people, and there's always room to, how are you doing? It's what we do. It's expected. I find that almost 100% of the men that are in this business are in recovery, and probably about 75 to 80% of the women that are in this business are in recovery. But everybody has a connection, whether it be a family member or something, a spouse or something like that. So I think there is a great deal of crossover between behavioral health
Yeah.
and the mentoring field.
Yeah. And I think it's interesting, a lot of, I mean, I totally agree with what you're saying. And I think a lot of people in corporate America, they, when we go around the country, or when we used to travel a lot, we'd find that less than 30% of people would say they have a mentor and someone they would go to for professional advice. And a lot of these people are managers and above. But then I would ask, how many of you are currently mentoring someone else? And the number was consistently under 10%.
Yeah.
Whereas if you go into a 12-step if you're in a 12-step program, it's,
it's mandatory.
It's kind of mandatory.
It's compulsory. Yeah.
Yeah, it's kind of it's
frowned
a given
upon to not have that.
Yeah.
Do you think that people do have mentors in the workplace, but they don't realize it? They just haven't labeled it, where they are mentoring other people?
Well, that's an interesting question, because I also say, like, someone you can go to on an ongoing basis for professional advice. And still, the numbers stay, pretty low, maybe 30%, usually under 30%, sometimes 40%. And I also noticed that most women, when I ask them, who mentored you? And when, who was, whether it's back in high school, a coach or a college career advisor or someone at your current company, who mentored you? And 9 times out of 10, the name is male.
Yeah.
And I think that that's another thing. I think there's a huge opportunity. Men, it's sort of, we've talked about this, it's kind of the old boys network. Men have been very willing to mentor. And, I think the notion also is very important of safe haven. People do need and are looking for a safe haven to open their heart and be, as you said, more vulnerable.
Right.
But a lot of times people in positions of power historically have been men. And I think it's our time. Women need to also step up and mentor men and women.
Right.
And ask for mentoring from both men and women. A lot of times people shy away because they think you're asking me 5 hours a week to get together, for the next 10 years. And
a big commitment. Yeah,
but it's not.
Yeah.
You're looking at maybe 1 hour every 45 minutes every 2 weeks.
Yeah.
Or for 9 months, you're looking at a 9 to 14 hour commitment in a structured mentoring program. And I think a lot of mentoring programs fail because there's no structure. In a 12-step program, you have structure.
Right.
You're working through the steps.
Yeah.
When we stand up mentoring program, there's a blueprint.
Yeah.
When we stand up a mentoring program, I'm working on it right now, is our sponsor action guide on how to champion other people. A mentor, we say, speaks with you. I know a sponsor speaks about you behind closed doors.
Yeah.
So what's your action plan over those 9 months?
Right.
What are you doing together? What are the goals of the relationship? And the goals in a 12-step program, sobriety.
Right.
Right?
Well, yeah. Well, at least. If not, a better, higher quality of life.
Very important.
Yeah. But
very important.
Yeah. Well, and I think that men are not often good at being vulnerable. Some men are, but it's generational, because our fathers and grandfathers came from a very different time where vulnerability and we didn't have these things. We didn't have the awareness, the psychological awareness that we have today. People are now what they call, woke is the new term, meaning, you're aware of what's going on. Are you present? And I think our generation does. I mean, I think, we at least know enough to say we don't know. And I think it will change over time. I think that, there will be more equality in terms of, men willing to be more vulnerable, willing to allow that of themselves, and I see it changing in terms of, I see this too, and I've seen this between you and I also, where more often women are the bread makers. They are the money makers. They are making as much as men. There's now more women in college than there are men in graduating and things like that. But that's not to say things like a changing model where people get an education in trade, which is something we used to do, could be also very important. As you mentioned before, you don't need a 4-year degree to have a good paying job.
Right.
So it all depends.
Right.
So I think there's, we've got to change, we've got to evolve.
Yeah.
In the workplace.
Well, I'm very lucky that you are vulnerable and we get to have all these good conversations. I thought it might be just interesting because, we haven't really talked about this, just to see what we come up with here. But, people are working for the first time with their spouses at home. They're spending a lot of time at home with their partner spouses. And, that's a lot of pressure on a relationship. And then they also have children at home. And luckily our daughter's 17 and our dog's 6. She's here with us at the office.
Somewhere.
She's our chief happiness officer, Naomi. But just how, what thoughts on how when things are getting tense and people are getting stir crazy. I know you're every day like, I want to get on a plane. I want to go somewhere. I want to visit, Denver, Utah. I want to go to Morocco. There's this edginess.
Really itching to get to go do something.
What are some strategies to keep, we say it's shalom bayit, peace in the house. And for people now, again, working from home and they don't have the same access to go out and get a breather, do you have any thoughts on that? Like things that mentoring advice to other couples and families?
Exercise. I think physical activity is really important. I try to do it, maybe I succeed at it 4 times a week, but I'd like to do something every day. Right before COVID broke out, right before the pandemic, I bought a new bike. And we live in Florida, so it was easy. It was a great time to bike ride here in March and April. But if it wasn't for that bike, I think I would have been in the psych ward a long time ago. It just physical exercise just changes you metaphysically. It releases chemicals in your brain that they say are similar to what the effect of drugs, the feelings that drugs give you. It's a natural high, and it changes you. It relaxes you. It takes out stress. It's just so important. I think even walking or doing anything, that's really important too.
Yeah.
That's my big piece of advice is stay physical.
Yeah, to get out there. And I know it's nice to like we'll walk the dog together once or twice a day. But also, trying to figure out when you need a little space. We are fortunate that we have an office a mile from the home, so we can come and just sort of change the scenery safely. And come here. But I think, one thing I know early in our marriage, like we were advised after you went to treatment, they said, it was advised to us by this great guy, Alan. He said, don't try to fix him.
Right.
Don't try to fix each other.
Right.
You're responsible for your side of the street. I'm responsible for my side of the street. So if, but take the space. And go work on yourselves and not try to, go in and fix each other. And that advice helped a lot because I think people view it as their responsibility in a marriage to try to fix each other, and then it can come across as criticism.
Right.
And when I stopped trying to fix you, you focused on yourself and worked, going to meetings.
And by the way, unsolicited suggestions are criticism. I was on the phone with a family member, not my family, but a family member I'm working with, and she told me how she called her sister and she told her how she was wrong, and I said, nobody wants to hear that. She says, why am I being ostracized? I said, well, because nobody wants to hear that. It really is that fixing myself.
You should is a very bad word. If you share from your own experience that you feel great exercising, I can get inspired by that. If you say, you could lose the COVID-19, Julie.
You're just never gonna make somebody. My dad's been trying to change my mom for 52 years. And God bless him, he's still trying, but
Oh, your mom's awesome.
Yeah.
Just the way she is.
Well, but you know how he is, so he just, he wants to.
Well, hi, Mel.
But anyway, yeah, no, I think these are good things, and I think just to, this thing will pass one way or another. It will pass. We'll get back out there. I think the workplace, having come in, this is going to be a long video, but having come from the commercial real estate space, I think that, my assessment of things are going to change. I think there are going to be more people working from home permanently.
Yeah.
There are companies that are looking at their rent bill that's $40,000-$50,000 a month, and they're saying, well, we now know that 60% of our staff functions just well from home. They don't need to be here, and so these are huge savings. And I think you're going to see that. I think you're going to see some empty. I would not want to be the owner of office buildings right now. I really wouldn't. Or or retail for that. Though I think retail will come back because retail is a form of entertainment where office space is not.
Yeah.
But we'll see. Or hotels, which are so.
Yeah, but it's very challenging when you're home and you've got small kids and you've got to be on a Zoom call, around the clock, and you feel like your kids are not getting enough what they need. It's very hard for working parents to, hopefully there's some division of labor, but it's, how they will, and if we don't go back to school.
Yeah, that's going to change things too, hugely.
Yeah. And so it's going to be interesting what innovations come from the situation come the fall. Yeah. But I guess we could have many of these many things to discuss.
Right. I mean, the whole thing. I mean, we'll wrap this up in a minute. But I mean, if school is online, right? Do I dare say that's not? Kids are not in school. I mean, that's I guess that's education, but they're not in school. So how do the parents work? Especially parents that don't have the resources for nannies or that kind of daycare. And if you put your kids in daycare, why not just put them in, why not put them in school? But the deeper societal issue is, if the school is daycare for a lot of families, and if that's not there, then who's going to be picking up the slack for some kids? And it could be the police, because then the kids are out. This is all kids. They're out. They're getting in trouble. They're left turn. They're bored. So who knows? I mean, it's a real new world out there. We have to see what happens. I think we'll be okay. We've survived this long. I think we'll survive longer.
Well, we had 15,000 new cases in Florida yesterday.
Oh, yeah.
But one of my clients, I'll call her Beverly. We did some flash mentoring with her company, which has a huge brand, amazing company, and she basically said, I'm taking care of 2 kids, I'm managing a team, and I'm trying to take care of everyone at home. And she said, and I'm about to lose it, and I'm on Zoom calls all day long. And what she needed, again, was more that one-on-one. So I feel for mothers and parents, reach out to another, maybe even mentor with another couple.
Yeah, that's a good idea.
Don't go it alone. Mm-hmm. And sometimes people just need that safe haven to talk and come up with strategies or find out how other people are working remotely but not isolating